Dr. Denise, the CEO of Commode Cancer Foundation. I would like to welcome you to our Commode Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Looking at our cancer awareness campaign segment, which comes up second and fourth week of the month in conjunction with Commode Cancer Foundation. Founder of Commode Foundation, Dr. Denise will be talking to us today, and she will also be having a consultant psychiatrist, Dr. Patricia, on how those living with cancer can cope with everything else. Over to you, doctor.
Good morning, everyone. Thank you for joining us.
Good morning.
Good morning, Dr. Denise. Good to see you.
I'm fine. Nice to see you too. I've got an echo. So let's go. Very quickly, Dr. Doing, welcome to this segment of the mental health aspect of our campaign, our Commode Cancer Foundation campaign in partnership with AIT. Today we're going to be looking at how people cope with cancer, how cancer patients cope during this journey. So firstly, I want to say, I hope you don't mind me calling you Dr. Doyin.
That's fine.
Dr. Ologun. I follow the rules, but let's go this way. Okay, so let's look at the starting now. First thing I want to ask you, because it's very interesting to understand the mental health of people when they go through cancer. And I'm a very big advocate because I did go through a lot of challenges personally. So I want us to look at it from what's the role of the psychiatrist in the cancer patient's journey. That's my first question to you.
It's like any governor is really taking
Very much.
Chief Dano Lassie, because there's no way he doesn't talk about.
Did you hear the question?
No, it froze.
It froze. So let me go again. So firstly, I'll say, what is the role of the psychiatrist in the journey of a cancer patient?
Thank you. The role of a psychiatrist is to assess the total emotional well-being of a patient, to make a diagnosis, and then to offer follow-up appointments, if necessary, throughout the journey of the treatment for cancer.
Okay, so when we look at it from understanding, I like the way you've done it because you've done the layman explanation of this. You know, we don't really like the technique, we're not doctors. So at what stage, therefore, would you say, what stage of the cancer treatment does the discussion start with a psychiatrist? Because I do know maybe not psychiatrist, but actually there's psychological aspect of the journey. So let me phrase it properly.
I would strongly advise the earlier, the better. From the point where a patient is thought that they might have cancer and has started undergoing assessments and investigations, that is probably the best time to start with counseling, because there's a lot a psychologist or a psychiatrist could offer to help them come to terms with what might happen, how they will feel, and how to manage that even before it happens.
So if you look at it from those two very simple, straightforward points, let's look at it and let's say, the emotional and psychological aspect, complications, or I'm trying to use different terms, disorders. You use the word disorders, I would say the complications. And what are they? What are the emotional disorders that cancer patients would go through? Because that I think will be the starting point of understanding the journey that is important to enable a cancer patient drive this walk with it.
Because the diagnosis of having cancer can be a very stressful one. It involves stress and can involve loss of different sorts. And therefore, you could develop any of the psychiatric disorders. But the most common ones that we tend to see would be things like depression, anxiety, or substance misuse, alcohol problems, illicit drug problems. Some people self-medicate to soothe themselves. You can also get complications from the medication that is being prescribed for the cancer. So if a person is prescribed, for instance, steroids, they might develop depression. And if they're very high doses, they could actually develop a psychotic illness from the medication being used to treat the cancer. So we need to be aware of this.
Okay, so fantastic. Okay, so now when we look at it from that perspective, the diagnostics, is that the disorder that you're talking about now, it's very rare, I would say, or am I wrong in assuming it's quite rare for a cancer patient to, for there to be cancer patients that do not go through some level of these disorders? Because I'm trying to think back, and I'm trying to also look at a number of people that I've been fortunate to work with on this journeys that have made it and those that haven't. But one of the fundamental things that's come up is this emotional well-being. Yeah. So what would you say is a good starting point? How would, we have, what do you call it? What do you call that thing? Anxiety. You get it? The two that are very, very strong to people, the ones that people really go through. How would you go through that? How would you discuss that? Because I don't really know. I've been through it. That's why I know, and I don't know how to say it.
I think to start with basic counseling from anybody, whether it's their faith healer or their, could be even a parent, their general practitioner, that would be the basic starting point. But if it developed into something more serious, then they probably need to see a psychiatrist. And I do understand that there is stigma attached to seeing a psychiatrist, but nowadays with Zoom, you could see a psychiatrist on Zoom. You don't need to see them face to face. You don't need to go to their clinic. You could see even a psychiatrist from another country using technology. So if people don't want to be seen in a psychiatrist's clinic, there are other means. And sometimes people see their general practitioner. The general practitioner treats them for psychiatric problems. The general practitioner can always speak to a psychiatrist and get advice, and then use that to treat a patient. So there are ways around this.
Oh, okay. So Zoom is helping us. Fantastic. Okay, so how can a diagnosis of a cancer patient affect one's social life?
Because it's associated with loss, it could affect anything. It could affect their relationships, their job, their, finances. And as you know, if finances are involved, they might lose their house if they're paying rent or mortgage. They could lose their car. They could lose even their friends. So it affects them, their total life.
So what would you advise? How would you advise us to?
It's a difficult one, but yet again, we go back to counseling to help them come to terms with what has happened and giving them basic advice, basic financial advice, basic marital therapy, basic counseling about things that they're struggling with. They might even find it difficult to fill out forms or having to deal with these things. So having family support is very helpful, or even friends, good friends that could support them through the journey. We shouldn't, take that lightly at all, because these are the sort of things that will see them through.
Yeah, I think that makes that goes. Now, okay, let's go back. Let's narrow that back into the Nigerian system, way of life. We do have, by nature, we are very supportive of each other, by nature. However, we also have to be very mindful of the kind of advice we get on journeys like this, because sense of hope sometimes overshadows the real issues that a cancer patient goes through. And I'm not taking it lightly, because I recall when I didn't realize I had gone downhill. And when I did, it took me I went looking for help and saying, I am not coping anymore. And I think it was when I was crossing the 5-year line. And by that time, I knew I started, all I could see was I may not cross the 5-year line. I may not make it. I may die before the end of 5 years. And that's sometimes, I don't think I've really ever said this, but that was a real eye-opener for me. So how do we help people? Because we have a funny way of thinking. I was able to say quickly, no, I'm not going to sink. I need to find help. But generally, culturally, we get help from the wrong places, in my view.
Well, what I'd advise is for patients, yes, to continue taking their medication as advised, but also to seek counseling. And as I said earlier on, if you need to go to your faith healer, be it a pastor or whether you go to an imam or whoever is going to support you through that, that's important, but not to stop your medication or prescribed treatment simply because you're doing these alternative methods of treatment. That is very important.
Yeah, that's a very good one. That's something that's come up a bit now. Okay. How can we help? How can these emotions, how can these emotional disorders be treated? So basically, you are saying that if we're going to be able to treat it, we need to fundamentally look towards the social care systems within our networks to be able to cross across the line. And however, if we need, can you give us an idea of where we can actually find counseling? Because some place, I don't know how much.
Either basic counseling, as I said, through your general practitioner or any clinical psychologist that's registered would be helpful, or a psychiatrist. And you can get these referrals from any general practitioner, any doctor. They'd be able to refer you on. There are lots of private hospitals now, both private psychiatric hospitals. There are lots of private clinical psychologists. The general and teaching hospitals all have psychiatrists and, counselors available. So that is the first port of call that people should be looking at to get this help.
Oh, okay, thank you. You've just answered one question I needed to get, and that was how do we get the help? Okay, how can a cancer patient, okay, you've answered that, no. How can a cancer patient avoid stigmatization, if they can? You see, I have to be honest, is that if they can.
It's a difficult one about the stigma with psychiatry, because having cancer sometimes is a stigma in itself. And then you have the added issue of advising someone to go to a psychiatrist. So it's almost like wanting to give them a second stigma. But as I said earlier on, you can either get that psychiatric care through your general practitioner or on Zoom. That's probably the easiest way if you can afford that. But as I said, all general and teaching hospitals, private hospitals, a general private hospital, if you can afford it, would be an alternative. But I understand that some clinics are held in the evenings in some teaching hospitals now, so that there are not too many people around when people attend, because they understand that there is a stigma attached to going to see a psychiatrist. But people need to understand the psychiatric doctors, first of all, are medical doctors, just that we specialize in a certain area. So it's just like going to see any other doctor. So maybe it is time to start breaking down this stigmatization about seeing a psychiatrist. We're just another type of doctor that looks after certain, emotional problems.
Oh, thank you. Okay, so why do cancer patients develop these emotional disorders then?
For different reasons.
And some people don't get them.
Yes, it depends on the personality of the person, whether they're resilient. It depends whether there's a family history of psychiatric or emotional disorders. It depends on the support they have, the support network from their family, friends, workplace. It depends on many things. It depends on their financial state at the time and how they see the future. But a lot of it depends on the individual.
So from what I'm hearing from you today, I'm fundamentally hearing that for us to navigate as a cancer patient, for us to navigate through this journey, there is a lot of self-development that needs to take place if we're going to be able to cross the line positively.
Yes.
And then the next thing is that also I'm hearing that you're saying that the processes is not a one-size-fits-all, but irrespective of wherever we're getting help from, we should be in a place to get it in any setting. So it's not fixed to a medical setting. Like you've referenced religious houses, you've referenced the groups, you've mentioned the fact that we can actually go and get it from our friends and our relatives. So if I'm looking at the holistic view, let us come out of the psychiatric journey from the perspective of just an ordinary cancer patient. Basically, with the right. So can I ask you that's the point? The discipline. There's this term I keep hearing: multidisciplinary meetings.
Yes.
Okay. Can you explain? Can you talk us through that, please?
Well, what multidisciplinary meetings are is just all the team that look after the cancer patient come together and have a professionals meeting. So you will have people like the nursing staff, the doctors from both angles, both the oncologist, the surgeon, and if necessary, the psychiatrist. You'll have the occupational therapist. Anybody that is involved in the care, even the counselor, anybody that's involved in the care of that patient will come together once in a while, say every month or every 6 weeks, and actually look at the case as a whole, see where the patient is at, and discuss the care pathway of this patient. What should we be, where have we reached, and what should we be doing next to support this patient? A holistic approach to the patient.
Okay, so I mean, no, the reason I've had to hone in on that is because of that holistic approach, because I did notice that wherever I felt there were gaps, I was very quick to be able to find them. And I'm trying to say to the general, anybody thinking or finding relatives in it, that where you are not feeling comfortable, you need to find a way to navigate around it rather than say, no, I can't get through the line. Okay, I'm going to ask you. So what is therefore the role of this? What is the role of the psychologist the same as the role of the psychiatrist?
I would say very similar, and they do overlap. The difference is a psychiatrist, one is a doctor and can prescribe medication. A psychologist deals with the variation in normal behavior. A psychiatrist deals with the variation in abnormal behavior. So similar, but slightly different. They sort of overlap, as I said.
Oh, thank you very much. Thank you, Dr. Doing. I'm going to not go past that because I'm very mindful of terminologies, and we're not focusing on the terminologies. Rather, we're focusing on how to help people get through this cancer journey. So, I want to say, give us one sentence or two tips that can help us help a cancer patient navigate through this journey.
I think patients need to stay positive, stay hopeful, keep their self-esteem up, and just continue life as normal, as best as one can. So I think that's it in a nutshell.
Thank you very much, Dr. Doyin Olowu, for joining us today. Thank you for all the conversation and what you have brought to the table. We want to also say that anybody watching, if you want to see where you can find this on our YouTube, Cornwall Cancer Foundation, YouTube, Instagram, all our social media platforms. And also, if you check on the AIT program for today, it is also on their space. So you can pick up and share with people that will enable them to be able to get the right advice wherever they are seeking help. Okay. Thank you. Thank you. I am looking.
Thank you very much, Dr. Denise Ejo. Always interesting as you bring human angles to these conversations, because most of the time what we talk about is treatment options and the rest of it, and the aspect of it which really has to do with the psychology of the people and how they can even cope with their everyday lives are not really captured. So I love that perspective which you've brought into this conversation, which I'm sure a whole lot of people who are experiencing this kind of health situation will find most helpful.
Yep. Thank you, and well done to all you do and the advocacy as well on your side. You're giving a lot of people hope.
We give each other hope.
All right, Dr.
Thank you.
Denise Ajoy is the founder of the Commod Cancer Foundation. Is it Commod or Commodity?
Commodity.
Which one?
I can't also. I think he said Commod.
All right, then. Have a fabulous day.
Take care of yourself.
Yeah, I can hear you.
All right. All right. Well, that's
Sorry.
It's always insightful to listen to her and also the conversations.
I think we're missing our audience. We can't really hear each other.
We can't hear each other
right now.
I can hear you. We're crashing.
Oh, okay. Okay. All right. So we say thank you at this point, and we'll say have a lovely day and take care of yourself.
Thank you. Thank you, Dr. Olowu, for joining us.
Thank you.
Bye.